Good day everyone, I am Rosan Paraiso and I am here to tell you something about first trimester screening.
Pregnancy is divided into 3 stages. This is what you call the trimesters. First trimester is the most dangerous and most important part of pregnancy because the development and formation of important organs occurs at this time. To be able to determine certain abnormalities, specifically chromosomal abnormalities, first trimester screening is done. For a start, what is first trimester screening? First trimester screening is an earlier way for women to screen for chromosomal abnormalities during pregnancy at its first to third month. Patients must be between 10.5 and 13 weeks, 6 days of pregnancy to have the first trimester screening performed. The optimal time to have the screening performed is between 10.5 to 12 weeks of pregnancy. Advantages of first trimester screening. First, it allows for earlier detection of an increased risk for Down syndrome and other chromosomal abnormalities during pregnancy. Second, if the screening test indicates an increased risk, chorionic villus sampling or CVS can be performed in the first trimester of pregnancy to determine if the baby has a chromosomal problem. This allows for more time for counseling and decision-making by the couple. Third, if the screening test does not indicate an increased risk, this allows some reassurance to the couple earlier in the pregnancy. And, based on preliminary evidence, first trimester screening can detect a higher percentage of babies with Down syndrome than the currently available second trimester screening test. These are the screenings done in the first trimester. First, amniocentesis.
Amniocentesis is a procedure which involves the withdrawal of a small amount of amniotic fluid for the purpose of genetic testing. How is amniocentesis done? An ultrasound is used for better visualization of the fetus and the placenta. A local injection may be given at the site of injection. Then a thin needle will be inserted in the abdominal wall to the uterus. A small amount of amniotic fluid will be taken, then removing of the needle will take place. Then cover the site with sterile gauze after the injection.
Chorionic villus sampling.
Chorionic villus sampling or CVS is an earlier alternative to amniocentesis. CVS is a procedure which involves the withdrawal of a small amount of the developing placenta that is made up of chorionic villi. CVS is typically performed between 10 to 12 weeks gestation, counting from the first day of the last menstrual period, or as determined by ultrasound examination. You must be at least 10 weeks gestation to have a CVS. You can be further along than 12 weeks gestation to have a CVS.
Ultrasound.
Ultrasound is typically performed in the abdomen, although in some cases it may be performed in the vagina. This form of testing is non-invasive, meaning there is no risk of harming the baby. During the ultrasound, the gestational age is estimated, and also during the ultrasound, a measurement is taken of the thickness of the back of the baby's neck. This thickness is also referred to as the nuchal fold thickness or NT measurement. An increased NT measurement can also be associated with heart problems and other genetic conditions. Blood test is performed on the mother to measure the level of 3 proteins that are normally found in a woman's bloodstream during pregnancy. The levels of these proteins may indicate an increased or decreased risk of the fetus having chromosome abnormalities. The proteins that are measured are: first, pregnancy-associated plasma protein A; second, free beta subunit of human chorionic gonadotropin; and alpha-fetoprotein.